Dr. Professor P.K. Pradhan, done my DM from PGI Chandigarh. I have been in this field of cardiology for the last 3 decades. What we have seen that most of the deaths in all over the world, heart attack is taking a leading role for all cause of death. Previously we had the concept that there are certain risk factors which causes the traditional coronary artery disease or heart attack. Those risk factors were I usually divide into 7, 3 sins and 4 diseases. 3 sins is created by us, that is tobacco in any form, lack of exercise or sedentary life, and obesity. These are the sins we do by ourselves and go for a heart attack. And diseases is not in our head, that is diabetes, hypertension, dyslipidemia, or if we have inherited the disease gene from the parents. These were the traditional 7 risk factors which was prevailing till Corona 2020. After that, what we are seeing, that we are seeing most of the young people are getting heart attack. What is the reason behind it? They don't have that traditional factors, because usually I say the traditional factors is our creation, because God has created us in such a way that He has guaranteed our life up to 100 years. The heart has to stop after 100 years, and a person whose heart stops at 100 years while he was playing with his grandson is the most blessed child of the God, because without suffering he connected his soul to the God's soul. We get the heart disease because of those 7 risk factors, which was traditional risk factor created by us. That's why when the heart attack occurs at the age between 50 to 60 or 50 to 70, it is a punishment given by God to us, because we have done some sin or we have been cursed by some things. But that tradition, that was the real characteristic heart attack which we are seeing up to 2020. Suddenly, in 2020, we saw a different form of heart attack. That's younger generation, while playing, doing something, or in a recreational activity, suddenly they collapse. And that has created a lot of anxieties and worries among the society now. What is the reason behind it? The reason behind it is mostly the corona has changed the risk factor scenario. In young, what we don't get that atherosclerotic process, means narrowing of the vessels and heart block. In young, when we do the angioplasty or angiography there, we see it is loaded with clots. No disease. Previously, what we are seeing, there is 70% narrowing or 80% narrowing, and thrombus is lodging on that. Now what you see, the whole artery is lodged by thrombus. So what is the reason behind it? Usually what we think now, that corona or its vaccine itself has increased the thrombogenicity in the human being. Means previously, suppose a thrombus activity was taking in a little amount, when something happens or some inflammation or anything happens to us, now the thrombogenicity, means thrombus forming capacity, has increased inside the body. So that creates a heart attack which is full of loaded with thrombus. That is what we call now is a type 3 heart attack. It is not type 1, which was a traditional heart attack. Type 3 is a heart attack which is occurring because of increased thrombogenicity, and it increases because of 4 factors. What happens? Anxiety, stress and depression. That increases that thrombogenicity. Besides that, smoking is another factor, means any addiction to drugs. And third is obesity and hypertension. These are the untraditional risk factor which is occurring in young people, and they are getting heart attack after corona. So what the young people should be careful about is they should be totally avoid any drugs or smoking. Second thing, exercise is a must. They should have a routine like that they should enjoy life, not be stressed so much with their duties and activities, because that causes depression, anxieties, and causes increased homogeneity. Second thing, it occurs more in female. So I will request all the young females to be out of tobacco and do regular exercise. And first, they should be conscious about their own health, because losing a life at the age of 20 is a great loss to the society. So I request all the young people, be healthy, try to be healthy. Health is first, money is next. Thank you.